According to the Antiphospholipid Antibody Syndrome Foundation of America, 1 to 5% of the general population has antiphospholipid antibody syndrome. Hello, my name is Kara Fountain, and I am one of those 1 to 5%. I never thought at the age of 15 I would be diagnosed with a blood clot running the length of my calf. In order to figure out why I contracted the blood clot in the first place, there was a lot of testing that needed to take place. I am a credible source because I experienced this syndrome firsthand with going to all the doctor's appointments as well as additional research that I have done on my own. I feel like I'm an incredible source for this topic. Today I will tell you about what antiphospholipid antibody syndrome actually is, the treatments available, as well as the lifetime effects. First, I will talk about what exactly antiphospholipid antibody syndrome is. Antiphospholipid antibody syndrome is also referred to as APS and is a lot more serious than people might think. According to the American College of Rheumatology, antiphospholipid antibody syndrome is an autoimmune disease which causes clotting. Most frequently, people with APS will see a blood clot in their lower extremities, such as their legs, such as I had. But APS can affect any vein within the body as well as any organ. People with APS can experience other things besides just blood clots. This syndrome can cause strokes, heart attacks, as well as miscarriages. And here is the packet that I received when I was diagnosed with antiphospholipid antibody syndrome. Next, I will talk about the treatments that are available. There are a few treatment options that have come out to help with antiphospholipid antibody syndrome. According to Holden, depending on how high your levels of antiphospholipids are, some can just get away with taking an aspirin every day. That thins out a person's blood just enough that they can get away with no more blood clotting. Also, changing your diet is a very critical part of the treatment. Since vitamin K is a coagulation factor, it causes a person's blood to become thicker and stickier. With this syndrome, you do not want that to happen. So anything with vitamin K in it, you have to be very careful eating, and only eating a little or eliminating vitamin K altogether in your diet. The most common type of treatment is to be put on blood thinners. I am currently on warfarin, which is the generic brand of Coumadin. This helps thin my blood to a level that ensures that I will not get a clot again. And here is the medication that I take every day. Antiphospholipid antibody syndrome does not disappear overnight. It has some serious lifetime effects that could take a major toll on some people. People who are constantly on blood thinners, such as I take, warfarin, you have to have an INR check. An INR check is where you go into a local doctor and get your finger pricked. The nurse then squeezes out a drop of blood onto a machine that then tells you your blood level. In my experience, I need my blood levels to be between 2 and 3. If it is higher or lower than 2 or 3, the doctor has to change the dosage of medicine that I am on. Also, if your blood levels are off, then you have to go in the next week instead of every month. You have to do this for the rest of your life. With these antibodies in my body comes along with an increased possibility of strokes. Since my blood is thinner than most people, I will also bruise easier, as well as my bruises will be darker and take more time to heal than a normal bruise would. The last lifetime effect I would like to tell you about is that only affects women. What studies have shown is with people that have APS, they have a high rate of miscarriages in pregnancy. According to Holly Cave in a News Republic article, these specific antibodies prevent the egg from embedding properly and causes blood clots in the placenta. There are some options for pregnancy. Aspirin, heparin shots are available. Since my blood antibodies are extremely high, I do not get the option of just an aspirin. I will have to give myself shots twice a day throughout the entire pregnancy. And here is what an INR machine looks like. This has affected my life for the past 3 years and will continue to affect it for the rest of my life. Now that you know what APS is, the treatments available, as well as the lifetime effects, I hope you have a better understanding. Having all the testing done has helped me figure out what exactly caused my blood to clot in my leg, which was extremely helpful. Before this speech, I never really talked about what I'm going through or what the syndrome really was, so I hope you all are a little more informed about my syndrome that I have been diagnosed with.